So dear students, welcome back to the GDC classes. So dear students, under the series of the TNMRB Pharmacist exam preparation, we have started the Master Stroke series in which we are going to discuss today is the pharmacology important MCQs under the topic that is known as the cardiovascular system. And yes, it's a very important chapter under the pharmacology because every year from the different pharmacist examination question asked from these topics. So what we are going to discuss in this today's videos, drug acting on the cardiovascular system, that will be the introduction, basic principle of the. So first question what we have today, that is the mechanism of action of the calcium channel blocker. Calcium channel blocker, it's a major class. So as its name indicate, that is the calcium channel blocker. What this does actually, when there is the high concentration of calcium inside the cell, then there will be the increase the contraction, and that contraction increases the blood pressure, maybe in the arteries as well as in the veins also. When we provide the calcium channel blocker, it inhibits the entry of calcium inside the cell. So yes, this reduce intracellular calcium ion concentration. Yes, this reduce intracellular sodium ion concentration. This reduce the intracellular potassium ion concentration, not at all. As its name indicate, it's a calcium channel blocker. So obviously it will inhibit the calcium channel, and that's why it reduces the entry of calcium inside the cell, and there will be the no contraction, that will relaxation and decreases the BP, reduces calcium entry inside the vascular and cardiac cell, reduces the intracellular calcium ion concentration, which leads to the relaxation and vasodilation. Yes, it also inhibit or also reduce the myocardial contractility. So here is the calcium channel blocker from which the calcium enter into the cells. When we inhibit this calcium channel blocker by the calcium channel blocker, and yes, calcium channel blocker mainly comes in three classes. First one is known as the dihydropyridine. Yes, dihydropyridine, where we actually have drug like dipene class drug, nifedipine, amlodipine, nicardipine, all the dipene class drug. Next we have the phenylalkylamine derivative. Phenylalkylamine derivative, that will we have, that is called as the verapamil. And the third one what we have, that is the benzothiazepine, that means diltiazem. All remember all the drug because these are very important. Next question, which of the following is a angiotensin 2 receptor antagonist? So angiotensin, that means RAAS system. Actually what happened? From the JG cells of kidney, in the kidney there are mainly two cells. One is the JG cells which secrete the renin. Yes, it releases the renin. While another cell we have, that is the peritubular cells which releases the erythropoietin. Now this renin, actually what it carried out? It carried out the conversion of angiotensinogen, which is produced in the liver. This angiotensinogen is converted into the angiotensin 1. This angiotensin 1 further converted into the angiotensin 2 by the enzyme called as the angiotensin converting enzyme. This angiotensin bind on the AT receptor, that means angiotensin 1 receptor, and by the binding on the AT1 receptor which is present on the blood vessels as well as on the adrenal gland, what it carried out? It carried out the vasoconstriction, and from the adrenal gland it secreted the aldosterone, that will further lead to the sodium and water retention, and BP will increases. At the target of the antihypertensive agent, firstly we inhibit the renin release, then we inhibit the ACE inhibitor, all the PRIL class comes under the ACE inhibitor, and we block this angiotensin receptor, where actually angiotensin 2 bind with their receptor, all the sartan class drug comes under this. So here is the PRIL, that is the ACE inhibitor, sartan, yes, this is the angiotensin 2 receptor blocker, amlodipine, calcium channel blocker, verapamil, it's also the calcium channel blocker. Remember the classification. The first we have the drug acting on the RAAS system. Direct renin inhibitor, that is Lidocaine. Angiotensin 2 receptor blocker, all the sartan class drug. Losartan, valsartan, condesartan, envaisartan, telmisartan, olmesartan, sartan class. When we have the ACE inhibitor, that is the PRIL, Captopril, enalapril, lisinopril, ramipril, pridopil, fosinopril. Then we have the diuretic. Diuretic mainly three classes here we use. thiazide diuretic, loop diuretic, and potassium sparing diuretic. Under the thiazide, what we have? Hydrochlorothiazide, indapamide, zipamide, clopamide. Under the loop diuretic, what we have? Furosemide, torsemide, bimetamide. And under the potassium sparing diuretic, mainly aldosterone antagonist spironolactone is used. Calcium channel blocker, phenylethylamine, benzothiazepine, diltiazem, verapamil, diltiazem, and nifedipine. All these drug comes under. Okay, remember this classification, because various time the question from the antihypertensive classification is very important. Renin is secreted from, already we have discussed, it's secreted from the J-Z cells of kidney, that is called as the juxtaglomerular cell. Yes, Kupffer cell present on the liver. Dendrites, it's a nervous cells target. Adrenal gland, no. So correct answer will be the renin is a protein which or an enzyme secreted from the juxtaglomerular of cells of the kidney, and what it carried out, it convert the angiotensin into the angiotensin 1. That's the target of the renin. When we provide the renin inhibitor, that is the L-Escarin, which inhibit this process. Which of the following is not categorized as the antihypertensive drug? So already we have seen ACE inhibitor and calcium channel blocker. Apart from that, already we have diuretic as well as the vasodilator. Under the vasodilator, there are mainly three classes. First one, we have the arteriolar dilator, artery dilator. Next we have the venodilator, which dilate the vein, and then we have the both, which dilate the artery and vein both. So drug will be under the arteriodilator, we have the MDH. That means minoxidil, diazoxide, hydralazine. These all are the potassium channel opener. Under the venodilator, we have the nitrate, and under the both, we have the sodium nitroprusside. So all the drug which dilate the arteries, minoxidil, diazoxide, hydralazine, they act through the opening of the potassium channel. So here will be also. Now what we have, that left one, that is the alpha 2 blocker. Actually, in the treatment of hypertension, we provide the alpha 2 agonist, clonidine and methyl dopa, not the blocker. So yes, alpha 2 blocker not a target of the antihypertensive drug. When we have the ACE inhibitor, angiotensin 2 receptor blocker, diuretic, calcium channel blocker, beta blocker, alpha blocker, alpha mainly 1 blocker. Then we have the alpha 2 agonist. Then we have the alpha 2 agonist. Then renin inhibitor, vasodilator. These are the different class what we can see under the antihypertensive drug classification. Next question what we have. Which of the following is a drug of choice for the pregnancy-induced hypertension? In the pregnancy condition, the uses of drug are very limited because maximum drug causes the teratogenic effect on the fetus and causes the fetal abnormality. That's why during the pregnancy, we have to be very conscious for the providing of the drug to the pregnant lady. Under this situation, what the drug mainly we use, the simple trick we can remember, better mother care during hypertension pregnancy. Hypertensive pregnancy. This is the trick. Remember that trick. Very important and very useful. Better means beta blocker. Yes, beta blocker can be used in pregnancy. Mother methyl dopa, which is itself a drug of choice during the pregnancy. So here methyl dopa will be the correct answer. Next we have the care, clonidine. During, yes, dipine. All the dipine class drug, dihydropyridine means calcium channel blocker. Hydralazine and prazosin. These are the drugs which can be used. Apart from that, atenolol can be used. Enalapril never used because all the RAAS system acting drug, whether it's renin release inhibitor or ACE inhibitor, or we have the angiotensin receptor blocker, these fully are contraindicated. Nitroprusside, which both dilator, can also not use. So correct answer will be the methyl dopa, which is the drug of choice during the treatment of the hypertensive pregnancy. And remember one thing also, methyl dopa activated in the form of the alpha methyl norepinephrine, and this alpha methyl norepinephrine also known as the false neurotransmitter. Yes, false neurotransmitter, because alpha methyl norepinephrine, it's a like derivative for the norepinephrine, but actually not. That's why it's also called as the false neurotransmitter. These are the drug of choice for the pregnancy induced hypertension, as well as methyl dopa undergoes for the Coombs test also, where auto antibodies are produced and test will be carried out there. Which of the following drug is given in hypertensive emergency? Now, previous one we have discussed the drug used for the hypertensive pregnancy. Now we have the drug for the hypertensive emergency. Both are different things. During the hypertensive emergency, actually what it happened, there will be the increased level of the BP at the situation will be there. So that's why we use the drug which dilate the both vein, artery, both, as well as make the drug of choice will be the hydralazine during that situation, but actually there is no option for the hydralazine. That's why the arterio and venodilator sodium nitroprusside can be used for this situation. So here sodium nitroprusside, which dilate the both artery and vein, yes, it is split into the nitric oxide. That nitric oxide will further lead to the generation of the CGMP, and that CGMP will dilate the artery and vein both, and yes, it can be used for the hypertensive emergency. It's not a drug of choice during the hypertensive emergency, because at that situation what we provide, hydralazine and labetalol will be there. Side effect of ACE inhibitor. All the ACE inhibitor have very common side effect, that is the dry cough. Why, sir? Because ACE enzyme is also responsible for the bradycardia metabolism. But actually, once we inhibit the ACE enzyme, then there will be the no metabolism for the bradykinin. And that's why the increased level of bradykinin will further leads to the what? Yes, it causes the dry cough, as well as all the ACE inhibitor causes the hyperkalemia. And in the first dose, hypotension adverse effect or side effect can also be seen there. So persistent dry cough, hypotension, first dose hypotension, and hyperkalemia, these all are the adverse effect of the ACE inhibitor. For that, we have to remember the simple word, that is the captopril. We remember all the things. Yes, it causes the dry cough, it causes the angioedema, it causes the postural hypotension, it causes the hyperkalemia. Yes, these are the different things. Angiotensin converting enzyme inhibitor diminish the blood pressure and oxygen demand by dilating the blood vessels. These are comes under the RAAS system. Persistent dry cough due to the pulmonary kinin accumulation, because bradykinin metabolism will not be there. Hypotension, first dose hypotension, and hyperkalemia can be seen there with the ACE inhibitor. Valsartan is used in the treatment of hypertension, angiotensin receptor blocker. Yes, it can be used in hypertension. Already we have gone through the classification of the antihypertensive agent. Normal systolic blood pressure. Actually, what is the normal blood pressure? Then you remember the 120 by 80 mmHg. Yes, it's the normal blood pressure. Here 120, that is the systolic blood pressure. 80 diastolic blood pressure. If the BP will increases from this level, it will lead to the hypertension. So always normal systolic blood pressure should be less than 120. Less than 120. Apart from that, in the pre-hypertension stage, the systolic blood pressure with the range in the 120 to 139. In the stage 1 hypertension, 140 to 159, and in the stage 2, that will be more than 160. And yes, when the hypertensive emergency, then at that situation there will be the more than 180 systolic blood pressure will be there. Okay. Now the next, anti-anginal agent producing the tachycardia as a side effect. We have gone through the classification of the calcium channel blocker. There are 3 classes. Dihydropyridine class drug means dipene class drug, and where we have the phenylalkylamine derivative verapamil and benzothiazepine derivative diltiazem. But out of these, there is one drug, nifedipine, under the dihydropyridine class drug, which causes the reflex tachycardia as well as decreases the insulin secretion. So never used in the case of the diabetes or in the case of the arrhythmia, because it already causes the tachycardia, means arrhythmia can be seen there. So the correct answer will be the nifedipine. Remember this one. Suppose there will be the verapamil. With the verapamil, there is the very common adverse effect, that is the constipation and ankle edema formation will be there with the verapamil. Remember both adverse effect because these are very important. So nifedipine, potent vasodilator, causing significant fall in BP, evokes the reflex tachycardia. That's why it's never used. Okay. So for complete preparation for the MRB pharmacist examination, GDC have launched the theory and objective, especially designed book for the TN MRB pharmacist examination. Don't miss this chance. Grab this opportunity and increase your result by the qualifying the final examination by the help of these two books. These books are available on the Amazon, Flipkart, GDC classes app, everywhere. An antihypertensive drug that caused the positive Coombs test. Already I have answered that methyl dopa shows positive Coombs test. Why, sir? Remember, methyl dopa is known to cause the production of the autoantibodies against the red blood cells, because methyl dopa develop some autoantibodies which can destroy the RBCs, leads to the anemia, hemolytic anemia, leading to the positive direct antiglobulin test. Remember this thing, it's already asked. Direct for the Coombs test, direct antiglobulin test carried out, as well as hemolytic anemia can be seen there. So positive Coombs test in the 15% patient around, it can shows the positive Coombs test, and hemolytic anemia can be seen there with the patient taking the methyl dopa. Captopril exert action by inhibiting conversion of. Captopril means ACE inhibitor. ACE inhibitor inhibit the conversion of angiotensin 1 to angiotensin 2. So correct answer will be the A. Angiotensin 1 to 2 conversion, it will be inhibited by the captopril, all the ACE inhibitor class drug, because ACE inhibitor prevent the conversion of 1 to 2 by inhibiting the ACE enzyme. Okay, when the angiotensin 2 will not form, that will not bind with the angiotensin receptor, there will be no vasoconstriction, there will be no aldosterone secretion, no sodium and water retention, no blood volume increases and decreases the blood pressure one side, and another side will be there, it leads to the vasoconstriction, angiotensin. But when we inhibit the ACE enzyme, then no vasoconstriction will be seen there. Which of the following antihypertensive is absolutely contraindicated in pregnancy? All the RAAS system acting drug are fully contraindicated. That means enalapril can never be used during the pregnancy. Methyl dopa we can use, nifedipine we can use, beta blocker labetalol can be used, but enalapril can never be used. So correct answer will be the A. RAAS system drug are fully contraindicated. Whether it's ACE inhibitor, angiotensin receptor blocker, or direct renin inhibitor, all cannot be used. Origin of heartbeat and its conduction is represented by, simple, from the SA node, that is also called as the pacemaker, impulse generated. SA node to AV node to bundle office to Purkinje fiber. This is the conduction pathway. SA node to AV node to bundle office to Purkinje fiber. D answer will be the correct. From here, SA node to AV node. SA node present in the right atrium. Then AV node to bundle office to Purkinje fiber. This is the conduction pathway in the heart. The antiarrhythmic drug of choice in most of the cases of acute paroxysmal supraventricular tachycardia, in short called as the PSVT. Remember this word, very important. For the PSVT, the drug of choice will be the adenosine. Yes, adenosine will be the drug of choice in case of the PSVT, paroxysmal supraventricular tachycardia. That is the abnormal heart rhythm or arrhythmia. This is the when short circuit rhythm develop in the upper chamber of the heart. I just name indicate. Paroxysmal supraventricular means above the ventricle, means atrium. When there will be in the upper chamber of the heart, what there will be the rhythm disturbed. The result in irregular or rapid heartbeat, stop abruptly. Drug of choice for the PSVT will be the adenosine, but also verapamil, sotalol, propranolol, amidorol can be used. Which of the following drug can cause torsade D point? When we study the classification of the antiarrhythmic drug, under that we find out the two classes which can cause the torsade D point. What is actually torsade D point? When we see the ECG, then we have the P wave, QRS complex, T wave. QRS, T, here we have the P. What is torsade D point? If any drug increases the QT interval prolongation, means if any drug increase the QT interval duration, that situation will be called as the torsade D point or QT interval prolongation. Under the classification, the measure we find out the 1A class drug and third class drug causes this type of situation. So what we have here, 1A, question produced difficulty, quinidine, procainamide, disopyramide. While the second 1B, what we have, medical lab, pharmacist, mexiletine, lidocaine and phenytoin. While the third class, what we have, find more problem, flecainide, disopyramide and propafenone. While esmolol comes under the class 2. Class 3rd, bindas will be there, that is beryllium, ibutyllite, dofetilide, amiodarone, sotalol. But these all do not causes the torsade D point. The correct answer will be the quinidine. So according to the classification, you can easily find out the 1A class drug and third class drug causes the QT interval prolongation. Next question. All of the following antiarrhythmic drugs are correctly matched with the group except. Okay. Have you remember the classification? Again, first class means sodium channel blocker. Second class, beta blocker. Third class, potassium channel blocker. And fourth class, that is calcium channel blocker. Under the first class, we have the three types, 1A, 1B, 1C. Under the 1A, we remember the trick, question produces difficulty. Medical lab pharmacist find more problem. Now, procainamide comes under the class first, yes. Amiodarone, here is the LOL, that means beta blocker. Under third, we have the BINDAS. Yes, amiodarone class third, esmolol class 4, no. Esmolol class 2 because it's beta blocker. Diltiazem, yes, under the fourth class we have the two drugs, verapamil and diltiazem. So easily we can find out these type of answer by the trick. Esmolol comes under the class 2. Esmolol comes under the class 2. Class third we have the amiodarone, sotalol, beryllium, dofetilide, ibutyllite. Class 4 we have the verapamil and diltiazem. With simple remember the word, one word, worthy. Okay. Next. Quinidine exerts its action on the sodium channel blocker. Yes, already we have discussed. All the first class drugs are called as the acting as the sodium channel blocker. Yes, quinidine's levorotatory, quinine used in malaria, but quinidine used in arrhythmia. Bicuspid valve, mitral valve is found in, or okay, we can see at bicuspid valve or mitral valve. What we have here is the heart. Here we have the four chamber. Right atrium, right ventricle, left atrium, left ventricle. Between the right atrium and right ventricle, we have the tricuspid valve, and between the left atrium and left ventricle, we have the bicuspid valve. So bicuspid valve present between left atrium and left ventricle. Okay, while in between the right and left there is no valve. Here is what we have. It's called as the septum. Yes, the septum, the line or the region which divide left part to the right part. There is no other. Yes, two more valve also there. One is called as the pulmonary valve, which present between the right ventricle and pulmonary artery. While another valve also there, aortic valve, will present between the left ventricle to the aorta. So correct answer will be the left atrium to left ventricle. That is the correct answer. Next question. Which antiarrhythmic is not class 1C? 1C, find more problem. Flecainide, moraxizine, propafenone. So here propafenone, yes we have flecainide, tocainide, but no tocainide will be there. Flecainide, incainide, propafenone will be there. Flecainide, propafenone, incainide and mexiletine. Here we moraxizine we have under the class 1C. Little effect on the repolarization or no effect on the repolarization. Which of the following can be treated with the lidocaine? Lidocaine treated it mainly used for the digitalis induced arrhythmia. If there is the digitalis induced arrhythmia, at that situation we can use. So for the PSVT, actually it's not useful. atrial fibrillation, atrial flutter, ventricular tachycardia, but the correct answer will be the ventricular tachycardia, because in the PSVT there is no use of the digitalis. Atrial flutter and fibrillation, for that we provide the beta blocker, but in case of the ventricular tachycardia, yes, we can use the lidocaine, the most frequently used drug during the ventricular tachycardia, and it's terminate the ventricular tachycardia. In the treatment of severe bradycardia, all following can be best modality of treatment except. What the question is have? In the treatment of severe bradycardia, all the following can be best modality of treatment except. We can use all the drug except. So atropine, pacing, isopretanol, diltiazem. So pacemaker can be used in the bradycardia. Atropine, which causes the tachycardia, isopretanol or diltiazem. Except, so correct answer will be the, in the calcium channel blocker, we never used for the bradycardia. But apart from that, calcium channel blocker always used for tachycardia. So for the bradycardia, we can use the atropine, we can use the sympathomimetic drug, or also we can place the pacemaker, but not the calcium channel blocker, because it's used for the tachycardia, not for the bradycardia, because it inhibits the calcium. That's why reduced contractility will be there. The mechanism of action of sodium nitroprusside. Sodium nitroprusside is a prodrug which further leads to the development of nitric oxide and which produces the vinyl cyclase. Vinyl cyclase increases the cyclic ZMP formation. So it increases the intracellular CZMP, not the CAMP, not calcium, not potassium. So increases the intracellular CZMP. Formation of CZMP will be there. Nitric oxide lead to the vinyl cyclase, will further increases the CZMP. That CZMP causes the relaxation of the blood vessels. Which of the following antiarrhythmic drug causes prolonged repolarization of the ventricle and ERP? Antiarrhythmic drug causes the prolonged repolarization of ventricles and ERP. Bole to means effective refractory period. So during the action potential, what we have the phase 0, phase 1, phase 2, phase 3 and phase 4. The potassium channel blocker, third class drug, mainly what it leads to the delay of the repolarization. That's why there will be the increased effective refractory period. So here third class drug what we have, that is called as the amiodarone. Amiodarone, ibutyllite, dofetilide, sotalol, beryllium, these all comes under the same class, which leads to the increased repolarization and effective refractory period. Which of the following belong to the alpha blocking agent and helpful in cardiovascular disease? Alpha blocking. So alpha blocking, here mainly what we used, alpha 1 blocker, prazosin, terazosin, doxazosin, tamsulosin, sildosin, these all are drug. Trimetrin, no sir, this is the potassium sparing diuretic. Valsartan, that is the angiotensin receptor blocker. Labetalol, beta blocker. So correct answer will be the doxazosin will be there. So prazosin, terazosin, doxazosin, these all are the alpha blocker. Shortest acting beta blocker used as an antiarrhythmic, esmolol. One and only one, esmolol. Yes, it's a shortest acting. While longest acting beta blocker will be the nodalol. Remember both. Esmolol, shortest acting, nodalol, longest acting beta blocker will be there. Dofetilide is which class of antiarrhythmic drug? Bindas means class 3rd. Dofetilide, ibutyllide, beryllium, amiodarone, sotalol, these all are comes under the class 3rd. The antihypertensive which cause decreased libido and impotence. Decrease libido and impotence, that is alpha blocker. Cut. That will be the selective beta 1 blocker, atenolol. Yes, these are the atenolol, metoprolol, carvedilol have high risk, whereas the nebivolol has the minimum risk of the erectile dysfunctioning. Okay. Which of the following is not a frontline antihypertensive agent? Enalapril, yes, first line drug. Hydrochlorothiazide, diuretic can be used. Amlodipine, calcium channel blocker. Atenolol, beta blocker. But beta blocker not comes under the frontline antihypertensive, yet it can be used for the symptomatic relief. First line we have the RAAS system. Beta blocker are no longer considered to be the first line antihypertensive agent according to the JNC Act. ACE inhibitor, calcium channel blocker, diuretic are the first line drug. Which drug should not be given in pregnancy? Never used RAAS system acting drug during the pregnancy. So ACE inhibitor cannot be used. So these are the important 30 questions from the cardiovascular system under the topic called as the introduction, antihypertensive agent and antiarrhythmic drug. In the next part, we will discuss about the angina and CHF as well as the myocardial infarction and other serious disease. So for the today, thank you so much to all. We will meet you within the next video. Till then, watch the video, clear your concept and improve your preparation. Thank you so much to all.